Okay, Canvas isn't working, so this is gonna go on YouTube. Hi Brenda, this is my clinical reflection video. So to start, a couple strengths that I demonstrated during this rotation would be just understanding, I guess, the plan of care and the actions taken by nurses. I was very prepared for this rotation. I think this is definitely the most prepared I felt going into any rotation. Whether it was looking at a heart rate strip or seeing what meds we were giving. I just knew why we were giving them. I could, see what was going on a heart rate strip and just kind of relate that back to like what the contractions that were happening. I just felt prepared. It was awesome. I kind of knew why we were doing what we were doing and didn't have to ask as many questions. I still had a lot of questions, but I felt really prepared. And I think that's in part due to how rigorous the curriculum has been. Although frustrating that first trimester, we were shot out of a cannon. It was definitely paid off, so that's cool. Second, I just felt very much more confident after the first week in being a male provider in a predominantly female kind of OB field. It was a good feeling because I've definitely felt some trepidation. And definitely the first week, but also just in the past. So yeah, that was definitely cool. And then just feeling much more confident working in the Pyxis, drawing up medications, hanging IV bags, doing all that, giving injections. Some weaknesses are to start just time management. I feel like as a student, will learn, but I'm just still not as good at being efficient with my time and clustering care as much as I should or could. I think there's a lot of room for improvement in that aspect. And then another weakness, I forgot to listen to bowel sounds on the first mom I was with the first day. I think it's in part just being a little nervous first thing in the morning and not having done a head-to-toe assessment on adult in a while, just because we had our peds rotation last semester, and then before that, I did just out of practice. And then another weakness was just navigating Epic efficiently. I work at Swedish where we have Meditech, which has a host of other problems, but I've gotten very efficient in it and can kind of navigate it pretty well. And so jumping back into Epic, although it's way more intuitive, I felt like I was not fumbling around, but it wasn't as succinct as I would have liked to have been. So as for SMART goals, my first one is I will practice one head-to-toe assessment per week until graduating nursing school in May 2023. Second goal is during clinical immersion, which is our next rotation. During clinical immersion, I will write down patient tasks each morning after handoff so that I'm adequately prepared before going into patient rooms. I think that's definitely really achievable and also relevant and measurable. Did I write them down or not? And will help to just have a better idea of what needs to be done in clustering care. And then the last goal is regarding EHR stuff. So after clinical immersion, I will be efficient in navigating patient records, orders, messaging, and charting in Epic. Hopefully where I have my immersion, not sure where that is, they have Epic. But a couple lessons that I learned, to go back to being a male provider, I just was very hesitant going into this rotation to be in a labor and delivery room and be a student and be a male and have a mom be okay with me being in there. And my nurse the second day said, Hamilton, there's plenty of male providers. They don't go in and ask, although that's very polite, but she's like, this is your job, just go do it and just kind of like step into your role. And so that was definitely a growing point for me. And I felt just like more confident, and it's polite to ask for sure. And, we'll continue to do that, but it was just a good practice. And then my nurse on the first day, her name was Michelle. She was so detail oriented and she was just so organized, and it was a great lesson just to pay attention to the details and try to get a very good understanding in the morning. And just every time you go into a patient's room of what needs to be done and what do you need, rather than going out to grab new IV tubing or this, that, and the other, just have a good idea. And I think it'll come with practice, but she was so dialed, and it was just so awesome to see. And she was just narrating everything she was doing for me. She was a great nurse. So that was definitely something to aspire to do. And then lastly, yeah, this was my favorite rotation. I didn't think it was going to be. I didn't know what to expect. I was really nervous, but I think I was very prepared, which helped. And it was just also fun. It was so exciting and interesting, and it was awesome to just know what was going on. I didn't think I would want to potentially go into OB, but I definitely am open to it now. I think that, having a child due here in April, is maybe where some of the excitement is coming from, and it's just like a perfect time to be in this course and have this rotation with little baby boy coming. So that's super exciting. But yeah, this is definitely my favorite rotation. I'm very excited to maybe look into the OB field more and see where it goes. But yeah, I think the biggest lesson was just preparation. And I think, your first trimester of your course was tough, but it prepared us a lot. And I think that having that preparation before even going into patient rooms and just that kind of work ethic, it will help and treat me well as a nurse in the future. Thank you. I'm over 6 minutes.